Mayo Clinic is where the ketogenic diet, the term was coined by Russell Wilder in 1921. So in many ways, it's an exciting sort of return to the roots in really understanding at the next level how the ketogenic diet is working and looking at it in a different condition.
A new groundbreaking research study from the Mayo Clinic is looking at ketogenic interventions for patients with bipolar disorder, but not just how it affects their bipolar disorder, but also how it affects their cardiovascular risk with some very specific cardiovascular tests. This could really be eye-opening about helping us with that risk-benefit analysis of ketogenic interventions. I'm joined by Dr. Kirk Nylen to discuss this study in detail. Welcome to Metabolic Mind, a nonprofit initiative of Baszucki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. Dr. Kirk Nylen, so good to see you. Thanks for joining me today on Metabolic Mind.
Thanks for having me, Brett. It's great to be with you.
Yeah, I mean, this is a treat because we're colleagues, we get to work together, and now I get to talk to you and pick your brain about some really, and about an important new study that's launching that we can talk about. But before we get into the details of this study, tell us about you. Let everybody know who you are and your position at Baszucki Group and how you got to this point.
Sure, thanks. So my name's Kirk Nylen. I come from the Midwest in Canada, from a small town in Saskatchewan. I started my university work in psychology, actually, and during my undergrad got really interested in epilepsy and studying seizures as a way of understanding neuroplasticity, learning and memory, and just how the brain works in general. That led me to go to U of T, University of Toronto in Ontario, Canada. I did my master's and PhD there at the Hospital for Sick Children in the Ketogenic Diet Clinic, and working on research studies really trying to understand how the ketogenic diet works to stop seizures. After grad school, I worked for the government for a few years writing healthcare strategy, and then was lucky enough to land at the Ontario Brain Institute, which had this vision of doing science in a different way, team science, everyone collecting same kinds of data, all those data coming into one place so people could use those data to ask whatever research questions they wanted. Was there for 12 years, and then had the good fortune of meeting Jan at a Millikan Institute meeting, actually, and learned about the work you guys were doing, and just thought, if the ketogenic diet can stop seizures that drugs can't even stop, of course it could be a powerful tool in treating many different types of neurological disorders. And what do we need to dial up or dial down to see how it can be effective in treating things like serious mental illness? So yeah, I'm the managing director of neuroscience at Baszucki Group. I've been with you for about 14 months now, and thrilled to be here.
Yeah, and your journey is so interesting about how it started with ketogenic interventions for epilepsy and now transitioned over to mental health, but also the way, I think what's really important is the way you see the science. And one thing we've talked about is sort of like that, the gaps in science and what has been studied, what is being studied, and what needs to be studied, and sort of having that framework. And with that framework, that's why I'm excited to talk about this new study that's starting at Mayo Clinic. Which obviously is, huge institution with an incredible reputation, with a large and very prominent psychiatry group, now taking the foray into metabolic psychiatry and ketogenic intervention. So give us a little bit about the details of this study.
Sure. Well, I think first of all, it's important to mention Mayo Clinic is where the ketogenic diet, the term was coined by Russell Wilder in 1921. So in many ways, it's an exciting sort of return to the roots in really understanding at the next level how the ketogenic diet is working and looking at it in a different condition. So they're conducting a pilot study in individuals with bipolar disorder between the ages of 18 and 40. When I say pilot, that just means it's a smaller study than a full-blown clinical trial. So there's 30 individuals that they'll be recruiting. And they're really looking at three things. The first is, what are the clinical correlates of being on a ketogenic diet versus not being on a ketogenic diet? In other words, how does the ketogenic diet affect the clinical outcomes that we think of when we think about bipolar disorders? So things like depression scales, mood stability, and so on. One of the really novel pieces of this project is they're also looking at the cardiometabolic consequences of being on a ketogenic diet. As you'll know, there's a common refrain that the ketogenic diet can increase risk for cardiovascular disease. And this is something that they're taking very seriously. And they're going to be following these patients through using all sorts of tests that you'll know way more about than I do, like IMT and endopat and so on, but really looking at cardiovascular health in these individuals throughout the study. And then lastly, and I think perhaps one of the most important pieces, is they're looking at an implementation plan. So if this work is successful in their hands, they've involved different parts of the hospital, different units of the hospital to get involved in this study from the get-go to understand what it would look like to actually build out a program for ketogenic therapy for all future patients. And in doing this, it'll help them really shape what implementation could look like in the future.
Yeah, so many interesting points in all three of those aspects. And the first being the clinical impact of bipolar disorder. And we have some studies from Dr. Sethi and Dr. Campbell has done one looking at patients with bipolar disorder. So is there going to be some consistency in terms of what they're measuring to sort of compare between the studies? And what are some of those outcomes that they measure?
Sure. Yeah, so we like to keep, at least at a core, some common data elements. So they'll be looking at things like blood ketone levels, blood glucose levels. I should say there's a run-in period. So for 4 weeks, individuals will be measured as if baseline. So treatment as usual. What do the blood levels look like of lipid markers, inflammatory markers, blood glucose, insulin resistance? And then when they initiate the diet, there's an 8-week segment where people are getting diet plus nutritional support, so diet counseling, and they're also getting behavioral health counseling. So that happens for 8 weeks, and then for the final 8 weeks, so it's a 16-week ketogenic diet intervention. For the final 8 weeks, they're dropping the diet support and just doing keto plus behavioral health counseling. I just wanted to make sure we had that context because it's relevant for the things they're measuring. So they're looking at blood biomarkers. They're looking at all the standard clinical inventories, which are consistent across the studies that we fund. And then again, they're looking at the cardiometabolic aspects of this, which is really the novel piece. That's something that's unique to the other studies that we've funded to date.
Yeah, that's the part that I'm really excited about, this combined cardiology and psychiatry study with Dr. Francisco Lopez Jimenez being involved. And the tests that you do for this have to be very carefully selected because it's a 16-week trial, right? So you can't measure, heart attacks and plaque development, by calcium score, things like that in 16 weeks. That's just too soon. But they're using some of these sort of cutting edge technology, whether it's measuring the endothelial function or measuring the thickness of the carotid artery, much more sensitive tests, which really haven't been done before in this combined ketogenic psychiatry intervention, have they?
No, and I think one of the really important pieces that we hope to come out of this is that it can give us a bit more insight into that narrative that we often hear, that the ketogenic diet increases risk of cardiovascular disease. And I think we really need evidence to bring to that conversation. Right now, I think it's mostly anecdotal and mostly unfounded concern, but this will really help us understand if there is something there or not.
Yeah, such a good point. I mean, it really is sort of a knee reflex assumption by so many physicians, just because we're not really taught about ketogenic interventions and we're not taught about the beneficial sides. We're only warned about the potential dangerous sides, which are kind of blown out of proportion based on what we see in the literature. So contributing to this further is so important with these types of studies. And then tell us more about the scaling. Like if this is successful, how do we scale? Which is also a really important part of the study. What are they doing there?
Yeah, this was something we had really good conversation with Mayo Clinic about. I mean, they've been a wonderful partner through this whole process. We really want to move away from the idea of funding a trial somewhere where the outcome is a publication and then that's it, and there's no impact on the organization itself. We feel that given the intervention, a diet, which doesn't require FDA approval for an institution to use, it's also been in use for over 100 years in clinics across the country, in pediatric epilepsy clinics. So we know that there's a known safety and efficacy profile there. And given all that, we feel that if this intervention is successful and in hospitals' hands, they should really be planning to implement it and offer it to their patient population. So that was the conversation we had with them. And what they committed to is involving all the various departments of the hospital where, who would relevantly be involved in this, whether it's cardiology, psychology, the diet team. They have a whole engineering department that looks at sort of process mapping, to involve them up front and really come up with a plan at the end and say, this is what it would look like for us to build out a full program, how it would be situated in Mayo Clinic, and how we think we could offer more value to patients. So we really think that this is an exciting way of doing research, especially when the intervention is one that is known and it's not, we know what the risks, we know what the benefits are, and we're not dealing with the unknown.
Yeah, and there's so many, quote unquote, centers of excellence in different fields in medicine. You could see how maybe this is paving the way for a ketogenic therapy, metabolic psychiatry center of excellence down the road. So I think that's really exciting. Now, I assume to enroll in this study, you have to be, present at Mayo Clinic in Rochester. So there's the geographic limitations. But if somebody wanted to enroll, they can, check the Mayo Clinic website, I assume. And Dr. Mark Fry is the principal investigator. Is that right?
That's right. Dr. Mark Fry is the PI for the study, and they'll be enrolling through the Mayo Clinic, through the psychiatry department there.
Great. Well, that's exciting. And thank you for the role that you've played in helping this study come to light. I know, your role at Baszucki Group, you're not doing the research, but you really are helping facilitate the research and helping the researchers come up with sort of the best protocols that they can to really make the maximum impact on the field of medicine and on the patient. So I appreciate your role in this, and thanks for joining us today to discuss this important trial.
Well, thanks for having me. And it's incredibly exciting to get to work with individuals like Mark Fry and the other researchers that we have the privilege of working with, and building capacity for much needed therapies, new therapies for people living with serious mental illness. So it's a real pleasure.
Yeah. And we'll link to resources in the description about where to learn more about the trial and to get involved. So, all right. Thanks again.
Thanks, Ben.
I want to take a brief moment to let our practitioners know about a couple of fantastic free CME courses developed in partnership with Baszucki Group by Dr. Georgia Eid and Dr. Chris Palmer. Both of these free CME sessions provide excellent insight on incorporating metabolic therapies for mental illness into your practice. They are approved for AMA Category 1 credits, CNE nursing credit hours, and continuing education credits for psychologists, and they're completely free of charge on mycme.com. There's a link in the description. I highly recommend you check them both out.